Okay, now the strategies that you have to be careful and remember all the time about part B. Let me try to make it a full screen just to be able to see it clearly. Okay, now we notice that in part B, the listening test, you have to listen to 6 different short recordings in absolutely a healthcare setting and answer the questions about each recording or question, because you have only one question, which is choosing the multiple choice. Okay, now in part B, you have to do these things. You have to listen carefully to the gist of the recording, to the main meaning of the recording, and we have to listen to specific details within interactions. Absolutely, you have to consider the speaker's purpose, then the opinion of the speaker, finally, the actions that will result from the workplace communication. Okay, now each of the 6 short listening tasks in part B lasts for approximately 45 seconds, and the recording absolutely is heard only once. It is impossible just to hear the recordings twice. So the recording will cover absolutely a workplace interaction involving healthcare professionals, such as a briefing or handover, something, or papers or something like that. You have 15 seconds to take a look at the questions before absolutely the speakers in the recording are going to speak, and 5 seconds to mark your answer after hearing the workplace communication. So there is only one question, as I told you, for each recording, which is selecting the correct multiple choice, and we have to use the 15 seconds to pause before the audio begins, just to give you the chance to prepare and to be ready, to focus on the question being asked. And absolutely, we have to think about how this question could be answered. Okay. So now the strategies that we have to be careful of, first of all, we have to know the instructions. So we have to be familiar, we have to make sure about everything which is said, and what you have to know, what you will be asked before the speaker is going to speak, or maybe the exam. So the instructions look like this. In part B of the listening test, you will hear 6 different interaction extracts. Now, in each extract, absolutely, you will hear people talking in a different healthcare setting. For each question or questions, absolutely, the questions now from 25 to 30, we have to choose the answer, maybe A, maybe B, or maybe C. Absolutely, which is the best one. Let me tell you something about choosing the correct multiple choice. You will notice, Joel, that the speakers are going to mention all the multiple choices, are going to talk about them, but you have to be careful, because you have to listen carefully to the main idea, just to consider or to check or to just to have your choice if the answer is A, or maybe B, or maybe C. Now, the context is really important. Part B of the listening test contains, as I told you, 6 different recordings. Each one, they are talking about a specific field of study or something. The recordings in the part of the test should be absolutely, you have to be familiar of all the 12 sections about medical workplace. Okay. Let me try to skip everything, okay, because sometimes the information is repeated. I don't want to lose my time in repeating something I have already explained. Okay, there is something which is really important. Now, in every recording, Joel, you have to only take a look at the question that is shown concerning the recording only. Don't take a look at the following questions, because if you want to do so, you will be confused, you will be lost, you will not be able to focus on the exact meaning of the recording. So please be careful, because every question about the multiple choices has a certain recording. You have to take a look only at the question about that certain recording. You don't have to complete reading, because as I told you, you will lose your concentration. So just focus on the question of the recording. that you are going to hear only. Absolutely, don't forget that underlining the words is really important because you have to listen. You cannot read and listen at the same time. This is something you have to keep in your mind all the time. Don't defy yourself because some students try to do so and absolutely they failed. So there are 7 different question types in the listening part B. It's about gist, it's about the detail, maybe the speaker purpose, the function, or the opinion of the speaker, or agreement or disagreement about the future actions. Let's talk about them one by one, and let's practice them because we still have some practice questions about every single detail in part B. Now, the gist is just to extract the main meaning of the recording. So, just the questions ask you to choose the option that correctly summarizes the information. Keep in mind that the speaker is going to mention all the multiple choices. Please, now your job is to listen carefully just to try to select the best or the correct multiple choice. So to answer these questions, you have to identify the idea, absolutely, the main idea or the gist of the interaction. This question is looking for an overview of the information given in the audio, not specific details, because I'm not talking now about details. So the answer choices will report the information in the recording with repeating the exact words. So this is the most common question type in part B. Okay, now the questions or the examples or the following list gives example about the gist questions. The questions that should be asked all the time. So we have to say, for example, what are the nurses talking about, or the doctors, for example? What is the aim of the research? Now, what about the vet, which is explaining about what? So please be careful about the gist question because you have to get the main idea about the recording. Now let's practice this exercise, which is about the gist question or meaning or the main meaning. Now track 7, we have to listen to track 7 and we have to answer the questions 1 and 2. So we will hear a dentist discussing booking problems with her receptionist. So let's listen to the recording and absolutely you have to take your own time just to take a look at the question. So this is the question. And now let's play the recording. So the recording is, let me take a look at the recording, which is track 7. Now let me give you one time just to read the question with its multiple choices to start the recording. Okay, so this is track 7. Let me play the recording and let's try to check the correct multiple choice. So thanks God, because we have finished talking about part A. Now it's the time just to discuss part B. Now this is the recording, which is 7.
You hear a dentist discussing booking problems with her receptionist.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So, Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
So This is the question which is about gist. Now, what do you think about the correct multiple choice? Now, what is the problem? Is it an error with booking system, a double booked appointment, or maybe a lack of communication?
I'm not sure because
Mm.
it's either A or C.
It's AOC. What do you think to repeat the recording? By the way, we are still practicing, Amjul. It's not that wrong if we want to repeat the recording.
I don't know if there's need because I heard both of them.
Okay. What do you think and why?
Why do I think what?
Why it is A and why it is C? You know what? I think I have a plan. I have a plan. Wait, Joel. I have a plan just to show you the correct answer. And to do so, I suggest to make you just read to the information that is said in the recording just to check yourself or to check the best answer. This is track 7. These are all the words the speaker mentioned in the recording. Let me check track 7. Yes, this is B. And sorry, I have to just scroll down to the recording just to show you
I
the
would have
exact.
put A
Why?
because it was the main problem. The doctor mentioned that she should have talked to her.
Yeah, this is
There
it.
was a miscommunication.
Yes, because of this, because she should have discussed this problem with her. She didn't do that.
Yes.
And because she didn't do that, she couldn't talk to her. So, exactly, this is exactly what you said. Let me show you. By the way, I have to show you. I don't know if the words that are mentioned or said are written. Please give me a second just to scroll down to mention the recordings. Wait. Yeah, this is track 7. Exactly. Let's try to discuss the information. If I want to do so, I think this is good. Okay. So we notice here, this is the whole recording the speaker is mentioned. We notice here, as you said, as you mentioned, okay, and okay, this is it. She should have discussed this with you at lunch at the end of the day, but she didn't. Because she didn't, there is what? A lack of communication. Because maybe if this happened, if she discussed this problem with her, absolutely, maybe the appointment could be scheduled maybe at a good time or at a certain time in the same week. Okay, Joel?
Yes.
So this is it. This is the meaning of just a question. You have to get the main idea, the main problem, the main discussion of the recording, because this is exactly what you have to do in this kind of a question, which is just a question. It's not the end. I think we are still practicing. Now let's listen to the second section of the next recording, which is now we have to hear or listen to a doctor discussing chest X-ray information with a medical student, okay? Before that, absolutely, I'm going to show you the question just to take a look at the question before playing the recording or playing the recording.
Okay.
Okay, so let me minimize this page. Wait, yeah, let me try to do so. And let's complete listening to the same recording.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back for Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details, full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
So this is everything about the recording. Now the question is saying, what is the doctor explaining? Is he explaining the order for discussing results to the patient, the information to include in patient notes, or maybe how to correctly examine the patient's condition?
I say it's B.